note cards, cotton ball, and water. Hi, my name is Amanda, nurse mom to you. I'm going to be doing your physical assessment today. Can I get your name and your date of birth, please?
My name's Sarah, and I was born June 30th, 2012.
Good job. So she is alert and oriented. She knows her name and her date of birth. Do you know where you are today?
I'm in Westfield in the bed.
You're doing awesome. Thank you. So she's alert, she's oriented, she knows where she is. She doesn't have any hearing deficits, which is cranial nerve 8. She is dressed appropriately for the season. She got her jammies on because it's getting a little later in the day. Her skin is warm to the touch. It is consistent with her ethnic background. She's articulate. She didn't have any range of or gait issues or range of motion issues. I haven't seen any involuntary movements, and she didn't use any assisted devices when she came in today. Okay?
Okay.
All right. So the next thing I'm going to do is palpate your head. See, did I say her speech is articulate? Her English, she speaks English. Probably going to repeat myself because I want to make sure I get everything. Her affect and mood is appropriate. It's nice and warm in here. She seems comfortable. So I'm going to palpate your head and your scalp. You let me know if you feel any pain or tenderness, okay?
Okay.
So her hair is blonde. It is evenly distributed. It's nice and thick. Do you have any pain or tenderness as I touch here?
Nope.
I don't see any creepy crawlies. I don't see any dandruff, any pain or tenderness here.
Nope.
Okay, awesome. Can I have you smile, frown, puff your cheeks, and I'm going to test your jaw. Can you open and close? I'm going to test her TMJ. Open and close again. No popping or cracking. Everything seems to be appropriate. Sorry, that's the dog. Next thing I'm going to do is I'm looking at her facial structure. Eyebrows, eyelashes, nice and full. They're even. She's got nice, pretty brown eyes. Her sclera is a china white. Conjunctiva is nice and pink and appropriate. Next thing I'm going to do is get out my otoscope and I'm going to check her red reflex. I'm going to come in from about 15 degrees, look for that red reflex. Then I'm going to look into the eye. I'm going to look at the macula. I'm going to look at the veins. Things should be paired. Shouldn't see any bulges in the veins or anything like that. You all right? Ready?
Yep.
Okay, so I'm going to go left eye to left eye. I'm going to come in here. See the red reflex? All right. Oh yeah, that looks good. Everything nice and appropriate pink. I see the light orange of the macula. Veins and are paired and even. Awesome, thank you. Need to check the light reflex. Pupils are equal, reactive, and round to light. When I put the light on one pupil, the other one reacts as well. Next, I'm going to check the cranial nerves 3, 4, and 6 for the 6 cardinal movements. If you'll follow my finger. Awesome, that was great. Next, I'm going to check her frontal and maxillary sinuses. Let me know if you have any pain or tenderness here.
Nope.
No, everything feels good.
Yep.
Okay. Sorry, that came awesome. I'm going to take a look at my note cards here real fast. Response to lights, consensuals 2 and 3. Okay, after the eyes, I'm going to look at the ears. And we're going to go nose and throat. and mouth. All right, so for her ears, I'm gonna palpate. They're equal. Do you have any pain or tenderness? I don't see any deformities. Everything looks normal. They're warm laterally to the touch. Because she is a child, instead of pulling up and back, I'm going to pull down to look at her ear canal. So I'm looking for her eardrum. It's nice and a pearly gray white. The pars tensa, I see the pars flaccida, the omnibus,
Whatever.
something like that. Right ear, the conal leg is at 7. I can't remember what the other name is. Conal blight,
And
pars flaccida, pars tensa. Your eardrum, I think that's about it there. Oh, the manubrium. Oh, I knew, and the umbo and the manubrium. That's what it was. Okay. Oh, I'm gonna look up her nose. We're gonna check for patency. Any breathing problems?
nope.
She does not have any allergies, so I would expect that she wouldn't have any trouble breathing right now. Obviously, she's a little tired. So I'm gonna look up your nose, okay? You're a great patient. So I'm looking at the turbinates. I'm looking at the mucosa. Everything is like a light pink. I don't see any inflammation. I don't see any masses or obstructions or anything of that nature. I'm gonna take off my gloves because I'm a little warm. Her septum looks good. All right, so now I'm gonna move on to her mouth. Her lips are nice and pink, appropriate. Now that you've got your mouth open, I'm going to look at her gums. Look good. Lift your tongue up. I'm gonna get a little light shining on here. Underneath her tongue looks good. The soft palate, I'm gonna look at the hard palate, or the underneath the tongue. Okay, stick your tongue out. Hard palate, soft palate. Her tonsils are 1+ or +1. Can you say ah? Her uvula rises when she does that. Probably should have left my gloves on. I'm gonna have you stick out your tongue, and that's cranial nerve 11. Go left and right for me. Perfect. And then I'm just gonna open your mouth a little bit. And everything looks good. Obviously, I would have gloves on, and I would use the gauze if I were working with a patient.
But she's obviously going to wash her hands after.
Which I probably should have mentioned. That was the first thing I did tonight, was wash my hands. Okay, now we're gonna go to the cranial nerve 12. Oh, gag reflex. I'm not gonna check the gag reflex because I think that would be cruel and unusual, don't you?
I don't even know what it is, but
I don't want to like stick your finger down your throat and kind of gag you. We don't want to do that.
nope.
Okay. So next thing we're gonna do, we're gonna look at the neck. We're gonna check for any masses or tenderness. Do you have any mass, no tenderness or anything like that? I'm gonna check her lymph nodes, preauricular, postauricular, occipital, jugulo-digastric, submandibular, submental. You guys sit up for me. And supraclavicular. Lean forward for me. Good. All right. I'm going to test range of motion and strength. Turn to the right against resistance. Good. Left. Resistance. Chin down. Up. Turn left. Turn right. Put your ear to your shoulder. Ear to your shoulder. Awesome. Shrug against resistance. Perfect. Okay. We're going to check for carotid pulse and Bruy. So, relax. Nice strong pulse, 2+ on both sides. We're going to check for Bruy. We're going to use the bell I'm gonna remember that now from the test. Brewy and Bell. Everything sounds good there. Everything sounds good there. Wow, I just hit myself. Oh, sorry about that. Okay, neck. Shrug, we did that. Cranial nerve 11. Okay, now we're gonna look at her chest. We're gonna look at the depth and her AP ratio 2-to-1. Everything, sorry about the noise, that's the dogs. I don't feel any masses or pulses. Do you have any tenderness? Do you have any tenderness here?
Nope.
Girls, sorry, I've got 2 dogs.
Crazy.
Deep breath. Okay, I'm gonna have you face the camera. Sit up, face the camera. I'm gonna check for symmetry when she takes a deep breath down here. Breathe in and breathe out. Perfect. All right, since I got you facing this way, I'm gonna go ahead and percuss and auscultate her back. So I'm just listening for resonance. Nice. And then I'm gonna go ahead and take a listen. And you're just gonna breathe normally, okay? No deep breaths or anything like that. Okay? Everything sounds nice and clear. Perfect, great. Go ahead and sit back up for me. We're gonna look at this, lean back a little bit for me. We're gonna look at this costovertebral angle here. Everything looks good. Now I'm gonna check apical. I'm gonna check for the apical pulse. Put your arms down, baby. So it's gonna be mid-clavicular, 5th vertebrae down. I'm gonna go ahead and lift, I'm gonna lift your shirt just a little bit, okay, babe? Feel for a pulse there. Oh, there it is. Good. I don't see heaves or lifts. We're going to listen here. I'm going to go kind of in a Z. Atrial, mitral. No, ape to man. Verbs point. So we're gonna go like, one thing I guess I should have mentioned is where we are. We're gonna go intercostal space between, intercostal space 2, intercostal space 3 on both sides. Then we're gonna go down mid-sternum, and then we're gonna come down to tricuspid and mitral. Do you have a heart? And again here, I'm gonna go under a shirt, okay? Nice lub dub sound, S1s and S2s. Doesn't sound, I don't see anything abnormal there. Now we're gonna do upper body range of motion and extremities. I'm gonna have you do your shoulders. We're gonna do wrists, elbows, test a little bit of strength. Put your arms out, resist, like pull your hands towards you. Good, now push away for me. Oh, turn your hands the other way. And push. Perfect. Everything feels good there. Again, her skin is warm, consistent with her ethnic background. We're going to check her pulses. We're going to check brachial pulse first. Radial. And ulnar pulses. Perfect. I think we're supposed to grade those up, so that would be like 2+. Upper extremities. Let's go ahead and do your, I'm going to lay you down so I can look at your belly. So what we're going to look for here, we're going to start in the right lower quadrant, right upper, left lower. We're going to listen for vowel sounds. Janarson.
I'm tired.
It's not moving.
Is it?
It's stuck. There we go.
Oh my god. That was scary.
Okay, I'm gonna pull your shirt up if that's okay.
Okay.
So there's symmetry. She does not really have an umbilicus. She has her mace, her button there that we're gonna get out here soon in maybe 6 months, right?
Yep.
Okay, I'm going to listen first. So we're gonna start in the right lower, as I mentioned before. And I'm hearing normal vowel sounds. Good. Now I'm going to do light percuss, just a couple centimeters. No tenderness, no pain. Awesome. I'm gonna use my hammer to check find the liver. So we're gonna go. I'm gonna listen for resonance. Ooh, nice. So her liver is not enlarged. It was normal for her size. I can check for the spleen. Should not be able to palpate it. I think I gotta listen for your aorta. Very deep. Liver, spleen. Okay. I guess we don't have to do the aorta. It would be just above her belly button. Check for bruit. Sounds good. Put your leg, uncross your legs for me. I'm gonna go ahead and check inguinal. I'll push right here a little bit, babe. Inguinal. Pulses. Femoral pulses. Awesome. Okay. Abdomen, umbilicus, bowel, vascular. Good. Okay, we are almost done.
Okay.
Okay, lower extremities. I'm gonna look between. I'm gonna sit you back up.
Superman.
Just to recap, in case I've missed a few things. Probably cranial nerves 3, 4, and 6 for the eyes. 6 cardinals. Oh gosh, I don't know what that keeps hitting. the shoulder shrug and come here, babe. All right, I'm gonna look between her toes. Everything looks pretty. Check capillary refill. Your toes are a little cold. But it looks
Haven't been
good.
wearing socks.
Her hair is evenly distributed. Of course, because she's so young, her skin is perfect, warm bilaterally. Skin color is consistent with ethnic background. No varicose veins, no cherry hemangiomas, anything like that. Okay? I'm gonna check popliteal pulse. Relax. Behind the knee. Good. And all her pulses are going to be a 2+. She's a normal, healthy child. If I forgot to grade them, they're all going to be 2+. Dorsal pedialis, relax. Or dorsal, or pedialis, something like that. And then at the top of the toes. Everything's nice and normal. I think pulses, popliteal, pedialis, tibialis, dorsal pedis. Oh, range of motion. Okay, come here and sit. Please. Honey, I'm going to have her come to the end of the bed.
Okay.
If that's okay.
Yeah.
All right. So I'm going to check for range of motion. Let your legs dangle a little bit for me. Raise both legs, like kick out your legs, left and right. Perfect. I'm going to have her do it against resistance. Perfect. Perfect. Lift your knees. Good. That's for the hips, range of motion. Sorry, babe. Do it again. Up, up, raise. Good. Lift your foot. Like this way. Like this way. Bring your toes towards you. Good. And then like you're pushing a gas pedal. Okay. And resist. Good. And push gas pedal. Good. Up. And push against gas pedal. Awesome. Okay, now we're going to test, we've done lower extremities. Now we're going to do neurological exam. You can go ahead and climb back up to the top of the bed. We're going to do stereographus and graphophagia. That's the one okay, sit. So close your eyes. Open your hand. Perfect. I'm going to put something in your hand. Let me know what it is. Close your hand. What is that?
Paperclip.
Good job. This hand, keep your eyes closed. Close your hand.
Penny.
There you go. Penny or a coin. Tell me what I'm drawing on your hand.
W.
No, try again. Let's try this.
Circle.
Okay, well, I'm not sure she passed that one. Let's do the other hand. Let's do. Your hands are so little.
In.
I'm gonna use this because her hands are so little. Close your eyes.
Circle.
Yes, there you go. And now try again. Open your hand up flat.
Circle.
No, it's not.
Little.
It's an 8.
Oh
Okay,
my God.
so maybe we need to learn our letters and our numbers.
It's
Okay,
hard.
you're gonna touch your finger to my finger and then to your nose. Faster. You do it a little faster. Down. Good. 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 Okay. Sit on. Let's go down to the edge of the bed. We're going to. I'm gonna have you stand. We're gonna do the Romberg test. So she's going to close her eyes, and there's gonna be relax. There's gonna be a little sway, but that's normal. She's actually pretty perfect. Go ahead and relax. Open your eyes for me. Do bend. Good. Can you go up on your toes and walk a little? Can you go on your heels and walk a little? Awesome. Oh, sit down. I need you to rub your heel against the other shin. All the way up, like this, all the way up. Perfect. Other side. Good. Awesome. And I believe the last thing that we're going to do is deep tendon. Oh, no, we need to do soft and doll touch. Okay, so close your eyes. I don't have a tongue depressor, so I'm going to use the end of my hammer in the top, and she's going to tell me dull or sharp. Okay, just relax. All right.
Sharp.
Good.
Dull.
Relax.
Sharp. Dull. Dull. Sharp.
Uncross the legs for me.
Sharp. Dull. Sharp. Dull.
Good. I'm not sure if we're supposed to do this or not, but I kind of remember it from Shadow of Hell. Stick out your hand. Tell me if, close your eyes. Tell me if you're moving your fingers up or down.
Up. Down.
Awesome. I'm going to do the same thing here.
Up. Down.
Awesome. And then we're going to do some light touch.
Ah. Okay.
Okay.
I think that's
Tell me
all.
if you feel that.
Yep. 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 Yep.
Awesome. And then the last thing we're going to do, just double check. I'm going to look at my note card one last time. Cool. And we're going to do deep tendon reflexes. Go ahead and take this off. So we're going to do brachial. So relax your arm for me.
Remember this part?
Yeah. We've practiced this a couple times. Then tricep. Relax. Good. Elbow or ulnar.
No, it's at the wrist.
2, 3. Yeah, a little. 2, 3. Oh, patellar. Put your leg down. I may have you come just a little bit this way. Good. Perfect. There we go. And relax. Relax. There we go.
Blossom.
Move,
Blossom.
Blossom. Good. Awesome.
My way.
Okay, then we're going to do Achilles. Oops. Sorry. Good. And then plantar, we're just going to, there we go, see our toes. I guess we should have done all this bilaterally. Oh, that's good. And I don't know if we have to do this bilaterally, but I would do that bilaterally. Did your chest, did your belly, did your upper body. We did pulses, did range of motion. I think that's about it. Thank you so